Thank you for having me here. My name is Mustafa Suppah. I'm finishing my interim medicine residency at Creighton University, Phoenix, and I'm very happy to be here. Yeah, actually, my interest in medicine started very early. I lost my dad and at a young age, so I experienced firsthand how having a sick family member can impact the entire family. Also, actually, my father was the first one that wanted me to be a physician, and he wanted actually me to like have at least once a month that I treat people for free. So hopefully I will be able to do that one day. And cardiology, I was always fascinated by the dynamics and physics of the heart as an organ, how everything makes sense, how it's intellectually challenging, which is something I'm looking for every day. And also, it's a perfect mix for you where you can do procedures, you can be in acute setting where you just step in a patient's room and can it change the trajectory of this patient's health. And also, you can have the opportunity to see the impact of what you do for this patient in outpatient setting. So, yeah, and I was always interested in cardiology even before I started residency. Yeah, definitely. Being a chief changed a lot of perspectives. You see things from like behind the curtains, as they say. So it widened my perspective. Also, you can see that reaching the same goal can be done through different channels, so it makes you more flexible. And also you realize that medicine is not always about those individualized like clinical decisions. It's way more than that, sustaining a healthy environment, sustaining good workflow, taking care of the team that's working with you, realizing that people have different personalities. So you have to be very flexible to deal with all of that and maintain the workflow and maintain that setting that everyone feel confident and feel reassured to work on. It made me more mature, I would say, and I grew a lot throughout this past year. So yeah, hopefully, me and my colleagues will be able to improve what the people before us did. They did a good job, but there's always a window to improve, like making sure that both patients and physicians are well taken care of. Patient will be always priority, but at the same time, taking care of the physicians will directly and indirectly impact patient care. So my goal is to prioritize patient care with also taking care of the physicians that take care of those patients. So I would say the proudest achievement. Personally, I think being a dad has changed a lot about me as a person. I'm way more patient now. Also changed my priorities, how I look at time, how I look at everything. And career-wise, I feel the journey itself is not like a particular spot. Like growing up in a different country, moving to the States, like being the first generation medical doctor, and being the first person in my family to move this to the States as well, and going through those different phases, doing a research fellowship, then starting residency, being chief, being involved in a lot of research, being involved in organized medicine, and having being blessed with all those opportunities eventually. And last but not least, being the chair for RFS chapter at ArMA, all of this, those opportunities I'm very grateful for, and I'm very proud of. So yeah, being involved in ArMA or in organized medicine in general is a blessing because you have the opportunity to contribute to something like bigger than yourself and something that impacts the system, which eventually will impact patient care and will impact the physician that is taking care of the patient. So having this opportunity to be the bond between like the healthcare providers and the political or systematic or organized medicine perspective of things has been a blessing. I learned a lot. I had one of my friends who was, or one of my colleagues was the past chair for RFS. I learned from her a lot, not only as an ArMA member, but also as a resident. So it's a great opportunity. I'm hoping to contribute even more to ArMA, and I'm hoping to achieve things that people will come after me will be able to build upon. So I would tell my younger self, just don't rush it. Just don't be harsh on yourself. You're not behind. Just show up, work hard, and it will work out.